Hi guys, this is a negative debate on the resolution. Reform healthcare system is more important than reform immigration system. First, I thanks the affiliate for their speech on the resolution, and these are the reason why I am on the negative side. Medicare, they says Medicare fail million. They leave out a key reason why. According to Pew Research Center, there were about 14 million undocumented immigrants living in the U.S. in 2023, and many of them work, pay taxes, and even receive emergency care, but they cannot fully participate in the healthcare system because they lack legal status. This creates inefficiency and financial strains. If we reform immigration first and allow these individuals to gain legal status, they can work openly, pay taxes through formal channels, and contribute more steadily to Medicare and Medicaid. That strengthens the very system that families say is failing. The family also argues that the national stability depends on Medicare reform first. Uh, but again, they ignore how Medicare actually works. It depends on the labor force paying into it, and immigrants are a major part of the U.S. workforce. In 2024, the U.S. Department of Labor reports that foreign-born workers make up 19.2% of the entire labor force. Without immigration reform, we cannot fully integrate these workers, which means fewer legal workers paying into Medicare. Their plan ends up weakening long-term stability instead of protecting it. And they also claim future immigrants won't be able to access basic health care unless Medicare is fixed first. But the real reason people avoid care is because our immigration system forces millions of individuals into the shadow. People without status and clean it out of avoid clean it out of fear and only seek help when problem becomes severe. Hospital must still provide emergency treatment, but they often don't get reimbursed, and those costs get pushed onto the rest of rest of us through higher premium and hospital bills. Immigration reform involving legal status, government issues IDs, and background checks would allow people to access the preventive and affordable care instead of relying on ERs. That reduce system strain and improve public health. So when the affirmative say Medicaid is a mess for immigration reform, they are missing up the cause and effect. Immigration reform is the prerequisite. It increase tax revenue, expands the legal workforce, reduce uncompensated care, strengthen government tracking, and actually stabilize Medicare's financial base. Thank you.